My name is Ashley Lewis, and today I will be talking about in vitro fertilization. This is a picture of the female reproductive system where the eggs are produced in the ovary and follow through the fallopian tubes and are implanted in the uterine wall, which is also called the endometrium. Merriam-Webster defines in vitro to be fertilization of an egg in a laboratory dish or a test tube. In vitro fertilization is commonly known as IVF and is an assisted reproductive technology where a complex series of procedures are used to treat fertility or genetic problems and assist with the conception of a child. IVF is the most effective assisted reproductive technology, and the procedure can be done using your own eggs and your partner's sperm. During IVF, mature eggs are collected from the ovaries and fertilized by sperm in a lab. Then the fertilized eggs are implanted into your uterus. One cycle of IVF takes about 2 weeks. Your chances of having a healthy baby using IVF depend on many factors, such as your age and the cause of infertility. IVF began with many theories and continued with research on in vivo and in vitro fertilization in a number of different animal species. When the key discoveries were made of the existence of the importance of female eggs and the function of the sperm in the 17th century, the science of human reproductive really advanced. This was also, for obvious reasons, closely associated with the discovery of the microscope. Walter Heap was credited for creating the first mammalian embryos in rabbits, but reported no pregnancies. And it was 60 years later, in 1959, that Chang was able to achieve pregnancies and births of live rabbits in following IVF. Once the basic research had been done in animal species, scientists and clinicians were ready to move the science onto treatment of human infertility. The main problem in applying the animal research successfully to humans was the difficulty in obtaining human oocytes. Up until the introduction of laparoscopy, pioneers both Palmer and Frankenheim, oocytes were collected by laparotomy. Patrick Steptoe and Robert Edwards, together a collaboration that after 10 years of research culminated in the delivery of Louis Brown in the 1978, the first child to be born as the result of in vitro fertilization. Patrick Steptoe and scientist Robert Edwards. After long wait and 9 months, on July 25th, 1978, they gave birth to a healthy baby girl, Louise Brown. There are 5 basic steps in IVF and the embryo transfer. Step 1 is where the fertility medications are prescribed to stimulate egg production. Multiple eggs are desired because some eggs will not develop or fertilize after retrieval. A transvaginal ultrasound is used to examine the ovaries, and blood test samples are taken to check hormone levels. Step 2, eggs are retrieved through a minor surgical procedure that uses ultrasound imaging to guide a hollow needle through the pelvic cavity to remove eggs. Medication is provided to reduce and remove potential discomfort. And step 3, the male is asked to produce a sample of sperm, which is prepared for combining with the eggs. Step 4 is known as a process called insemination. The sperm and the eggs are mixed together and stored in a laboratory dish to encourage fertilization. Some cases where there is low probability of fertilization, intracytoplasmic sperm injections may be used. Through this procedure, a single sperm is injected directly into the egg in an attempt to achieve fertilization. The eggs are monitored to confirm that fertilization and cell division are taking place. Once this occurs, the fertilized eggs are considered embryos. In step 5, the embryos are usually transferred into the woman's uterus 3 to 5 days following egg retrieval and fertilization. A catheter or a small tube is inserted into the uterus to transfer the embryos. This procedure is painless for most women, although some may experience mild cramping. If the procedure is successful, implantation typically occurs around 6 to 10 days following the egg retrieval. In this diagram, it represents how, in both male and female, the pre-treatment as well as the mixing of the sperm and egg in a test tube develop into an embryo, which is then transferred into the mother. This diagram targets specifically how eggs are harvested from the ovary and are mixed into the test tube with the sperm and then implanted back into the uterine lining after they are fertilized. In vitro fertilization is mainly done to help a woman become pregnant. It is used to treat many causes of infertility, including advanced age of women, including advanced maternal age, normally above 40, damaged or blocked fallopian tubes, which can be caused by pelvic inflammatory disease or prior reproductive surgery, such as your tubes being tied, or cysts, so forth and so on. Endometriosis and the male factor infertility, including decreased sperm count or a blockage. It also includes unexplained infertility, which are still under investigation through doctors and clinicians. There are several advantages to using IVF. I've targeted 4 of them. The first one would be blocked tubes. For women with blocked or damaged fallopian tubes, IVF provides the best opportunity of having a child using their own eggs. So instead of having to get a surrogate or having to find a different form of eggs, as in from another person or from a bank, they can harvest their own from their ovaries. Um, the advantages of this also include people who have PCOS, also known as polycystic ovarian syndrome, which is a common condition where the hormone imbalance leading to an irregular menstrual cycle. IVFs have proved to be very successful in patients with PCOS who will not respond appropriately to fertility medication in isolation. IVF also works very well for older patients with low ovarian reserve. IVF can be used to maximize the chance of older patients conceiving. At Create, they have found a way to use great expertise with older women to create embryos with low ovarian reserve. They use natural and mild IVF to focus on quality of eggs rather than quantity. So knowing that older patients may not produce as many eggs or might not even produce very healthy eggs, they're able to target the quality and the more, I would say, healthy eggs to use for IVF. Another advantage is male infertility. So couples with male infertility problems will have a much higher chance of conceiving with an IVF than conceiving naturally. So there's a number of laboratory techniques to facilitate in using intracytoplasmic sperm injection, where they can directly take the sperm and inject it directly into the egg instead of having to just mix it in a test tube and having to wait for it to be fertilized. The 5 cons I focused on in this slide pretty much target what a couple needs, wants, their persistence, and the severity of their infertility. Um, that kind of determines how long they would continue the IVF and how persistent they are with continuing the IVF. IVS can be time consuming and expensive, and it's very invasive. An IVF cycle may be unsuccessful for the first couple of tries, and the success of IVF is not guaranteed. Patients often have to undergo more than one cycle before they are actually successful, and currently just over 25% of all IVF cycles result in live birth. There are also some associated side effects. As a medical treatment, IVF comes with a small chance of developing side effects such as ovarian hyperstimulation syndrome. Multiple pregnancies can also occur from IVF. For people who are looking to have just 1 or 2 children, there is a likelihood that they could produce more than one. In IVF treatments, there is often more than one embryo put back into the uterus, which is more so for the effectiveness than for the quantity. And this leads to the higher likelihood of multiple pregnancies. Around 20 to 30 of IVF pregnancies are multiple pregnancies. There is a slightly higher chance of ectopic pregnancy with IVF treatments, only because the route of method that they use for traveling, or it might not exactly be in the uterine lining, and the traveling of the actual embryo throughout the uterus may actually travel to the fallopian tubes. With IVF treatment, the risk of an ectopic pregnancy doubles to 1 to 3%, particularly in women with damaged fallopian tubes. Many people may say that IVF is ethically wrong. I have the reasons listed on this slide. The reasons include bypassing the natural method of conception. Um, this also includes the creation of life in a laboratory, fertilization of more than one embryo than will be needed, and the discarding of excess embryos. Those two come into play with the pro-life and pro-choice only because it gives people the power to decide what should and should not have life. Um, Many people argue that the unnatural environment for embryos is not what should be happening with babies, as they say. The use of untested technology, since many of the techniques used for IVF are fairly new, people think that it's not as effective or it may cause health risks. Um, they also argue that it's not affordable for many, which is true because you do need more than one, well, may need more than one treatment of IVF. Um, the misallocation of medical resources. So, the continuous use of medical resources and the use in different places for medical resources comes into play because they feel as though there are more important things that could be done with this research. Um, the creation of embryos and then freezing them and keeping them in limbo kind of is like the freezing of human life. So it's kind of like you have the control over being able to keep or kill human life, depending on how people feel an embryo is defined by them. The exposure of embryos to unnatural substances such as chemicals or the media that might be in the petri dishes, the use of a pipette to transfer them. All of these people feel like are unnatural because that is steering away from the natural method of conception. Um, the destruction of embryos, again, in research, people argue as being a part of pro-life and pro-choice, not being able to choose whether the child is really a child or if the parents have the choice to destroy that embryo. The potential to create embryos for medical purposes, because there's a continuing research wanting to be made in stem cells. This also opens up another way for them to use stem cells, which they have been currently using but can't use because of laws that ban it. The potential to select embryos. So it kind of plays into the creation of embryos or the creation of children, where people have to, or not have to, but want to create an embryo with specific hair color or eye color, maybe taking out a deformity. Also, the potential to modify embryos, which comes into play with, I guess, the selection of embryos. Also, the facilitation of the idea that embryos are commodities. So this kind of makes it, disposable. Like, you don't really need it, but we can make it anytime that we want. They also feel as though financial rewards for IVF doctors dissuade them from recommending other methods to couples. So because IVF is so well paid for by the customer, although it's not covered by insurance, the doctor is of course going to recommend that before they recommend any other treatment option. And infertility is treated as a disease, and therefore the underlying symptoms are not technically being targeted, such as like PCOS. Instead of treating the PCOS, doctors might just use IVF so that they can get pregnant, but when it comes to the next round, when they want to have another child, they're going to still have the problem of conceiving a child, which would make them have to do IVF again. My discussion deals with a couple, Amy and her husband, who have had multiple tests to try and find the cause of their infertility. They began their treatment in 2007 with a privately funded IUI and went to try 4 more cycles of IVF that were also privately funded. Although Amy became pregnant on their second cycle, but the pregnancy was not viable, which means that the pregnancy was not successful. The attachment was successful, the embryo was created, but it wasn't viable. It didn't actually produce anything. After spending a large amount of money on trials of IVF, do you think that Amy and her husband should now resort to a new method, or do you think they should still continue to use IVF? Are there any ethical problems that may have come into play with their situation? And how do you think their relationship now between the two of them is affected by the multiple cycles of IVF, the large amount of monies having to be spent on these treatments, and now having to find a new treatment to resort to? Do you think that it may also hurt the relationship? Do you think they became closer because of the amount of time, money, sweat, tears they had to put into creating a new child and the attachment they might have had to each child. Um, what do you think may happen?